Hi, I'm Hilary Talbott, acupuncture physician and clinical herbalist, coming to you today from St. Petersburg, Florida. Today I will be showing you acupressure techniques for pain in the foot. Now, it's really important to understand where the pain in your foot is coming from. It could be actual structural issues in the foot, as well as all the way up in the knee or the hip that are causing you your pain. And there are many different acupuncture meridians that run through the foot. So in order to decide which points are best for you, it's important to have a diagnosis as to where your pain is stemming from. In order to find a qualified acupuncture physician to help you do this, visit acufinder.com. So the 2 points that I'm going to show you today are actually located kind of distally away from the foot. And this is because if you have pretty strong pain in the foot, you might actually not want to press in that area, especially if it's bruised or swollen or red. So the first point I'm going to show you is bladder 57. Bladder 57 is located just lateral to bladder 58, which is kind of in the heart of the gastrocnemius muscle here at the calf. And so if you kind of just follow this muscle up into the divot, that's 57. And then you come a diagonal way down to 58. Now, I'm choosing these points because these points often kind of have an effect on the entire foot, especially if you're having trouble with motor control. Let's say you have a stress fracture in one of the bones in your foot and you're actually having trouble walking or keeping your weight on it. Sometimes deep pressure with the thumb in the back of this these points is enough to kind of unblock the channels to give you some relief so that you can walk. Another important set of points is located on either side of the Achilles tendon, as well as around the heel. So for foot pain, I often see plantar fasciitis. And for those of you who don't know, plantar fasciitis is just the fascia of the foot is kind of like a weave. And so in a perfect world, it lays flat like this when we walk on it. When it becomes inflamed, often after periods of inactivity, like when we're sleeping, it kind of starts to shorten up like this. And then we get out of bed, and as soon as we put our weight on it, it doesn't want to lay down, and that causes excruciating pain. Another thing that can cause excruciating pain back in this heel area is bone spur. And that bone spur will get like these kind of stag horns that push into the fascia, and that causes the pain. So it's really important to understand where your pain is coming from in order to have an effective treatment. But these 2 points on either side of the Achilles tendon are actually really helpful. This one on the outside, just located in from the high point of the lateral malleolus, is bladder 60, and kidney 3 is just on the other side. So pinching in this area is often effective if there's some tightness here along the Achilles tendon and into the base of the heel. And then the other points are an extra set of points called 3 whites. And these are often utilized with both of those conditions. And it's where the red and the white skin meet, just on either side of the heel. And you really want to give it firm pressure when you push in, to the point where it like kind of makes you wince a little bit. And this is kind of trying to trick the fascia into laying back down, or break up any calcification and bone spurs that might be there. The third point is located right at the end of the Achilles. So often I'll kind of grab all of these or massage around the perimeter of the heel and kind of dig in with your thumb. And then if you really want to go for it, it's kind of an ouchy pain that feels so good when you're having this type of pain, is right in the center of the heel. And so you're really going to have to dig almost, and you want to use your thumb. And so when you use your thumb, you don't want to just use the pressure of your thumb, but the leverage of your entire arm to really get in there. Again, it's really important to understand the origin of your foot pain in order to correctly treat it. So visit your local acupuncture physician to get a correct diagnosis and find out which points are significant to your pain. I'm Hilary Talbott, and that was Acupressure for foot pain.